Assalamualaikum and very good day. Abid to Prof. Norazia and all my fellow friends. We are from Group 4. We'll be presenting about vaccination causes autism. The title of the article that we use is Measles, Mumps, Rubella Vaccination and Autism. And the presenting author is Anders Viet from State Serum Institute, Copenhagen, Denmark. And this is our group member. Next, I will pass to my group members to continue the presentation.
I will explain briefly for the introduction. Firstly, what is autism? Autism is a childhood onset development condition which the sufferer commonly associated or stigmatized for their poor communication, abnormal behavior, long life dependency, mental retardation, schizophrenic, and bizarre behavior. Parents often self-blame themselves as one of the causes of this condition. So the risk factors causing autism are careless behavior during pregnancy, a bad gene, or their advanced age at conception. However, the blame due to autism has shifted to an external factor, which is vaccine. Nowadays, the myth of measles, mumps and rubella (MMR) vaccine have caused autism among children is widely spread among parents. As a simple yet believable explanation, due to the incomplete and weak immune system of the toddler, vaccination is said to be overstimulated and causing damage. In the 1990s, Wakefield started a study due to the sudden increase of autism cases after the MMR vaccination. He hypothesized that the measles virus in the vaccine had triggered inflammatory lesions in the colon, which disrupted the permeability of the colon, which allow neurotoxin measles virus reach the bloodstream and the brain, thus causing autism.
Tymerosal in vaccine. Tymerosal is a mercury-based preservative that has been used for decades in medicines and vaccines. Tymerosal is usually added to vaccine vials to prevent growth of microorganisms such as bacteria and fungal. The usage of Tymerosal in medical products has been recorded of being very safe as human body can terminate Tymerosal easily. Thus, we are focusing on articles regarding MMR, DTaP and DTaP HIV vaccine, as presence of Tymerosal is remain found in these vaccines. Making our main purpose of this research is to evaluate whether the vaccine increases the risk for autism.
From the first article that used nationwide cohort study which done by Anders et al., they evaluate whether MMR vaccine increases the risk for autism in children, subgroups of children, or time periods after vaccination. This study is conducted in Denmark, and the chosen participants were from the children who were born in Denmark of Danish-born mothers from 1999 until 31 December 2010. Next, for the second article that was conducted in Poland by Mrozek et al., they want to determine is there any relationship between the MMR vaccination and autism in children. They also want to determine whether the risk of autism differs between use of MMR and the single measles vaccine. It was a case control study with study population of case sample using 96 children aged 2 to 5 years diagnosed with childhood or atypical autism, while for the control sample, they used 192 children.
Next, the third article is about comparison children with autism to those without by looking the risk of prenatal and infant exposure to Tymerosal from vaccines. The study design is case control conducted in USA where the case sample consists of 256 children with autism spectrum disorder and 752 children act as control sample. For the last article, an epidemiological study was conducted to observe the fluctuation of autism cases since 1979, even though MMR vaccines was introduced in 1988. Based on the UK, the children with autism born since 1979 were selected as population study.
MMR vaccine is one of the famous vaccines that people relate with autism. A research that conducted by Anders in Denmark investigated the subgroup of children that had been defined according to a few factors as listed here. The result of forest plot in the slide shows most of the horizontal line cross the middle line, which is the new line, and indicates this factor has no effect to the risk of autism. The p-value of statistical tests also not significant, which are greater than 0.05, shows there is no association between all these factors here with the risk of autism. Besides MMR, other vaccines that consist Tymerosal also become one of the concern to the risk of autism. Based on the research of Christopher, the case children and control children had similar cumulative ethyl mercury exposure at the end of each exposure period. The result of statistical tests here shows the exposure to ethyl mercury from TCI prenatally or in the first month of life was not significantly associated with any of the autism spectrum disorder outcomes.
The next article showed that there is no association between MMR vaccination and autism in children by assessing the odds ratio value. All the odds ratio were below 1, which showed that the vaccinated children had a smaller risk of getting autism. Next, the odds ratio for those vaccinated with MMR is lower than those having single vaccination. Thus, MMR has smaller risk for autism. The next article by Taylor et al. Showing that there is no epidemiological evidence for causal association in terms of autism and MMR. The results show that the p-value was not significant. Therefore, there was no significant difference in age at diagnosis of autism between children who was vaccinated before or after the age of 18 months and those who never vaccinated.
Vaccine hesitancy has been declared as one of the top 10 global health threats by WHO as of 2019. As we can see, vaccine hesitancy has increased, especially in the community, and this actually begins way back in 1998, when a website called The Lancet has published an article by Dr. Andrew Wakefield that linked MMR vaccine to autism. However, there are many studies that have debunked the findings of the original study. Based on the previous studies, we can conclude that MMR vaccine does not lead to increased risk of autism, even if the children is associated with environmental or familial risk factors.
Results from a study conducted by Thompson shows that there are no link between vaccines and neurodevelopmental disorders in children. There was also a study indicate that increased exposure to vaccine is not responsible for the increased rate of autism. The theory of vaccination can cause autism might arise due to the usage of thimerosal in vaccines. Tymerosal is a mercury-containing preservative used in vaccine to prevent contamination. Study by Di Stefano failed to associate autism with exposure of thimerosal-containing vaccines. A case control study conducted by Price found that there are no significant association between exposure of thimerosal with the risk of getting autism. And lastly, a population-based study by Taylor do not support a causal association between MMR vaccine and autism.
Next, for the conclusion of this study, we can conclude that ethyl mercury from Tymerosal containing vaccines and immunoglobulin preparation was not related to increased risk of autism. Other than that, MMR vaccination has been proven does not increase the risk of autism and also does not trigger autism in susceptible children. It also proved that MMR vaccination is not associated with the clustering of autism cases after vaccination. This finding has been proven by other research done by Dorota Mrozek, Batzin et al. And B. Taylor et al. Thus, to increase the acceptance and uptake of MMR vaccine, we recommend the media to spread the findings of the studies supporting MMR vaccination through global news, so that more audience will realize about the debunked study that claims MMR vaccination causes autism. Next, the government should improvise the law through implement of new acts to prevent the spread of false information about vaccines. And last but not least, healthcare professionals should explain the myth of vaccination causes autism to pregnant mothers and parents with children. The healthcare professionals are usually the most trusted source of information on vaccines. By equipping the healthcare professional with tools to communicate with parents will contribute to establishing more trusting and constructive dialogue. This is our reference. Then that's the end of our presentation.